I'm going to show the incision here for this hysterectomy that we're doing on this little Shih Tzu Yorkie to expose the uterus so that we can tie it off, remove it. You see subcutaneous tissue. A little young Yorkie like this doesn't have a lot, and that's okay. That makes things easier. That's why we advocate doing between 4 to 6 months. This one is about 10 months, which is too old to be doing it. Really, it can still be done, of course, but there's a push for doing things later. You wait till they're in heat, there's a greater chance for breast tumors. I just resected a breast tumor on a dog yesterday, and it was an older dog that had not been spayed. And so we're removing this, getting down to the muscle layer. Trying to make that stab incision at what we call the linea alba, where there's less blood supply. Little 15 scalpel blade, and then these Metz and Dom scissors, using those to further our cut of the abdominis rectus muscle. Pulling it away, we don't want to cut intestine here. The intestine lies right under that, and voila, we're in the abdominal cavity. And so that we like to use, I like to use the snook hook, the Spay hook, to find that uterus, and it lies behind the urinary bladder. Sometimes, depending on their level of being in heat or not, it can be easier to find. Slide it down, rotate the hook, pull it up. And you see I've got omentum. No, I actually believe I have the uterus there. So this dog's in heat. This is a thick uterine horn, that left uterine horn for a Yorkie. And then you see the cornu, the branch, the uterine body there. That's the left, the right branch actually of the uterine horn. So I'm going to break this down. That suspensory ligament, the finger. Okay, and then I'm going to go ahead and clamp that off and show that, and then we're going to sign off here and finish this surgery. So you break through the broad ligament, make a little window, okay, and then this ovarian artery we like to clamp off as such, and then I like to double clamp with that curved mosquito hemostat. And then I'm going to use a straight mosquito right up here at the round ligament between the uterine horn and the ovary. So I got the ovary right here. Very important not to leave any remnant of that ovary or the dog will still go into heat cycles and you have a mess on your hands. And then, one more thing before signing off, you want to make a good cut right along even with that. See that blood flowing there? So if these clamps weren't on there, we'd have a mess. Break down that broad ligament. See how tight that is? Tight little rubber band like ligament. And then that one didn't want to come. You heard that snap, I hope. All right, so that's all.